Hi, I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner and one of your co-hosts for the Melanin Initiative. I'm back for what I'm calling one topic at a time. Today, that topic is high blood pressure. And that's just when I come in here and talk to you about one topic at a time um, that we don't always have time to address in our weekly episodes. So today, that topic is high blood pressure. I had a really interesting conversation with a gentleman about high blood pressure this week, and I thought it would be really helpful for us if we talk about it on this platform, because the conversation that I had with him, I've had many, many times with different patients. And so I know that there is a gap in knowledge when it comes to understanding what high blood pressure is and how we go about diagnosing it and treating it. And so even though every patient has their own unique situation, um, we also have a lot of things in common. So the conversations I have with a patient on any given day, I've likely had it hundreds and hundreds of times before, because if when it comes to age, race, gender, your diagnoses and the medications that you're taking, you're going to have very similar experiences to someone who has who's in the same situation as you. So a lot of times patients will tell me that they're experiencing something, and I can help them with that. I can help provide clarification or address questions because I've taken care of people who have had this similar experience. And so I know that this conversation I'm going to share with you today about high blood pressure is not an isolated event. So he went to his doctor and they told him that his blood pressure was elevated. So they gave him a prescription to add on a second blood pressure medicine to his current regimen. And he wanted to know if he should take it because he had waited like 24 hours, and he even went to like a retail place and retook it and saw that it was still high. Um, and so he had questions. And so my first question to him was, does he have a blood pressure monitor at home? And he said no. Oh, he said he does have a blood pressure monitor at home, but he hadn't been using it like he knows that he should have. And so what I told him was that, without your information at home, the provider only has the information in front of them. And because we don't have your information from home, we don't know how long your blood pressure has been elevated. And that just increases our concern for your risk. So we know that the longer your blood pressure stays elevated, the more at risk you are for experiencing a heart attack, a stroke, and it affecting your kidneys. And so we really want to prevent complications as much as possible. And so a provider has to write notes every time they take care of a patient, and they document that your blood pressure was high. If they don't also document a treatment or a response to that, they become liable for anything that happens to you. And so we want to prevent complications in your life, and we want to protect our license. So the gentleman said, he has a blood pressure monitor at home. He doesn't use it. He's checked it now 3 times within a 24-hour period, and it didn't go down. He's worried that it hasn't gone down, and he's wondering, should he take this new blood pressure medication? So what I told him, the first thing I wanted to know is, did he understand what high blood pressure was? What is high blood pressure? And so he said, sometimes I get like a headache in between my eyes. And so, and I've heard this many times before. So what he's describing are symptoms when his blood pressure is elevated, but he hadn't yet actually given a definition for what high blood pressure is. And so then I rephrased the question and I said, well, what's happening to your body when you have high blood pressure? And he said he didn't know. And so, that's the first place we always want to start. If you're in a clinical setting and someone is making a recommendation, if they're giving you a diagnosis, the first thing you want to do is understand what the problem is. It's just like if someone fixes your car or your HVAC and they try to tell you you have all these problems, your first inclination is to not believe them. And the same thing happens so the same thing does not happen in healthcare. What I've seen is that people just kind of take our word for it, and whatever we say, they just kind of follow it. But they don't always follow it to the T, and I believe that's because the baseline understanding of what the actual problem is has not actually been addressed. So the way I like to describe blood pressure is, take, for instance, the picture of a water hose, right? On the inside of that water hose is nothing else but water. It can flow very freely. That's just like your blood vessel. Only thing on the inside is blood, and it can flow very freely. So over time, sometimes that hose gets gunk on the inside. And just picture what happens to the water when you get gunk on the inside, to that water. It has a much harder time getting through. And so we see the same thing when it comes to high blood pressure. So your blood vessel, instead of having gunk on the inside, there's all this plaque buildup, which comes from having high cholesterol. And so now the blood is having to push more, requires more pressure for that blood to get through. That's where the high blood pressure comes from. Now, we know that high blood pressure is also called hypertension. And I'm really on a mission to get us to stop using that word and to use high blood pressure more often, because I think hypertension creates, it gives the wrong impression, particularly to patients who often one thing they know about the word hypertension is the word hyper, which is a feeling and a sensation. And so for many patients, they believe that that is their indicator for whether or not they have high blood pressure and whether or not it should be treated. And so I've had many patients tell me that they didn't feel hyper or they didn't feel something, and so that's why they didn't take their medication. But we also know that high blood pressure is called the silent killer, and that's because you can have high blood pressure and not have any symptoms. Now, a lot of people will experience headache or not feel like themselves or experience fluid retention. Those are possibilities, but they are not always the case. And again, they are not uh, what we consider a diagnostic. They're not a marker for whether or not you have high blood pressure. The only way to know if you have high blood pressure is to actually measure it. Other than that, you're just guessing. So let's go back to the hose. So you have this hose, there's gunk in it. It requires more pressure to get water through. It's the same thing with your blood vessel. There's all this gunk on the inside, and it takes more pressure to get through. Now, just picture if you were to take that hose and bend it in half. What happens to that water? It can't get through. And that's what happens in a heart attack or a stroke. But instead of the blood vessel bending, there's actually so much gunk that it's prevented the blood to get through. And that's one of the causes of a stroke in particular. But with high blood pressure, we're trying to prevent that complete blockage from coming. And so we prescribe medications that make it easier for the blood to get through and decrease that pressure. In a lot of ways, blood pressure is at least in the beginning, it can be a volume issue, a fluid problem. And so that's why oftentimes the first medication you'll be prescribed is what's known as a water pill or a diuretic. And that's because we're trying to help flush out all that excess fluid that has been building up. So that's just the simplest way to talk about blood pressure for this conversation. Remember, we're just going to keep coming back and we're going to build on our knowledge from there. So, back to the gentleman I was talking to. So now if you understand what's happening to your body, now you understand why you need those medications. You also understand the risk that we're trying to prevent. So he's within a 24-hour period, he's taken his blood pressure 3 times, and all 3 times it's been elevated. In this case, it was more than 160. So I don't know how long his blood pressure has been that high. So I can't continue to go on without doing something about it so that we prevent that heart attack and stroke. And so that's why the doctor orders a second prescription to help prevent those complications. Uh, Now, what I told the gentleman is that the best thing for him to do at this time is to take the medication and also start checking his blood pressure more often so that when he goes back, let's say in 3 months, he can show a whole log of blood pressures that have ideally gone down, so they'll no longer be in the 160s. Within 3 months' time, maybe 150s, 140s more consistently. Maybe he's lost about 10 pounds by then, and he can show all these changes he's made, all these lifestyle changes. He's eating better, he's moving more, he's getting more sleep, that can show his provider that he's actually taking it seriously and he's making the necessary changes. Because medication for high blood pressure, it's not a cure. It's just to help alleviate that pressure so the water can get through, so this blood can pass. But it doesn't do it's not addressing the gunk per se. There are some medications like high blood pressure medications that can help with that, but again, it's not a cure. So once you're put on that, if you don't make lifestyle changes, you're going to always need it. It's not that in healthcare we just want to give out prescriptions all the time. But what happens is usually we look at your risk factors, right? When you go to your primary care, they screen you, they check your blood pressure, they ask about your family history, they look at your weight. Based on that information, they'll say, okay, where you are right now, let's say your blood pressure is in the 130s, and let's say you're about 35 years old and you could stand to lose about 20 pounds. Well, I'm going to give you 3 months to make lifestyle changes. I'm going to give you 3 months to lose weight primarily, and I'm going to look for that. And when you come back in 3 months, that your blood pressure is no longer in the 130s. If you do all those things, and then I say, okay, look, we're moving in the right direction. I give you another 3 months, you come back, you've lost the other 10 pounds, and now your blood pressure is consistently under 120 for the entire 3 months that we've been apart since the last appointment. So, this is a great time to talk about pain because the gentleman I was talking to, he thought if he made a few changes within 24 hours that his blood pressure was going to significantly go down. And people understand pain really well. So if you have a headache and you take some Tylenol right now, within an hour or two, you can expect to see some significant change where either the pain goes down or it goes away completely. Well, high blood pressure is not the same thing as pain medication. So take that hose. When you buy a brand new hose, it doesn't have gunk right away, and it takes a while for that gunk to build up over time, right? It's the same thing as your blood vessel. It takes a while for that gunk to build up, and it's going to take a while for it to go down. And so, unlike pain medication, where you take something today and your pain might go away tomorrow, your problem might go away tomorrow, high blood pressure isn't like that. Once you're in this category, it's going to take time to get there. That's just the physiology of the body. But even though we're waiting to get there, you can still be making changes. You need to be making changes once you get your diagnosis. You need to be making those changes while you're on the medication. You need to be making those changes once you get off the medication if you meet that goal. Not taking the medication only further increases your risk for other problems. So we're talking about blood vessels. You have blood vessels throughout your entire body. So again, keep picturing that hose with the gunk in it. So let's talk about if that hose is in your brain, right? So the blood, it carries oxygen and nutrients to every part of your body. So if your brain doesn't get oxygen or nutrients, what's going to happen? You're going to have be at risk for that stroke, as well as a form of dementia, right? Because that organ's not getting what it needs, so it's not going to function like it should. We see the same thing in the eyes, where the blood vessels are very tiny, so it doesn't take a lot of gunk to start to see problems with our vision, blurriness, nighttime vision. Let's talk about them in our lungs. That's how you can end up with a pulmonary embolism. And these are only one example of many different ways you can get to a problem. We can talk about it in our arms and our legs, and that's how you can end up with really bad pain, how you can end up with needing infections and amputations because those organs are not getting the oxygen and the nutrients that they need. Talk about the kidneys, same thing there. Just like the gentleman who inspired this podcast, if that organ doesn't get the oxygen, the nutrients it needs, it starts to shut down slowly over time. And you end up with chronic kidney disease, and eventually you can end up with what we call kidney failure or renal failure requiring dialysis, like that gentleman that I've talked about previously. So just to recap, we talked about high blood pressure. High blood pressure, we're talking about your blood vessel, your artery in particular. And I likened that artery to a hose. And I compared what a brand new hose looks like, just like a very fresh artery that has no problems, to a hose that builds up gunk and makes it very difficult for water to pass through. We see the same thing happening with blood passing through. And so the medications are necessary to prevent our complications, primarily heart attack and stroke, as well as kidney failure. And so unless you're actually taking your blood pressure at home and you have a log of that for at least 3 months, then we have to go by the number that we see in clinic. So when we're talking, there's a lot of blood pressure monitors out there. I'll put some links in the caption on how you can find some that are recommended by the American Heart Association. But the key is you just have to check your blood pressure. What I usually like to see people do, like within 2 weeks, check it like 3 times a day. So you get a really good understanding of what makes because blood pressure fluctuates throughout the day. And so you'll get to see like how it's affected from work, from when you're off work to when you get a lot of sleep, when you're not getting a lot of sleep, when you're hydrated, when you eat certain foods, particularly how that affects your blood pressure. Because oftentimes people will say, oh, it's only high because of X, Y, and Z, something that they just did, drive to the office, rush off of work, had a conversation that made them upset. But that's because while those factors can be a contributing factor, they wouldn't necessarily lead you to be diagnosed, because all those examples other people experience, and it doesn't change their blood pressure. So I want the takeaway today to be understanding the physiology of what's happening to that artery, and none of that is affected by external factors like whether you sat in traffic, whether you're stressed out, or whether someone just made you upset. It's really something you're going to have to change. High blood pressure medication is not a cure. It's like what I typically also say is like, it's like, say you have a crack in the wall and you put tape over it. The tape will help keep anything from that, like say there's a water leak and there's a crack. The tape will prevent the water from leaking out, but the crack is still there. And we have some really good tape, like we have some really good medications. But over time, you can only put so much tape over there. The water's going to keep coming through that crack. And unless you actually make changes to repair that crack from the inside out, you're going to have complications that we want to avoid. And again, that tape doesn't fix the crack. Blood pressure medications are not a cure. So I thank you for your time. We're going to address high blood pressure in an upcoming episode as well. So look out for that. I'll have our email and all our social media links in the description box. Of course, we welcome all your questions, your comments, your suggestions, and your concerns. Thank you for watching.